Bismillahirrahmanirrahim. Botryomycosis. Botryomycosis is a chronic granulomatous reaction due to bacterial infection, either Pseudomonas or Staph aureus. There is nodules that make sinuses, releasing sulfur granules. Now we will see the clinical picture. So it is a chronic granulomatous reaction to bacterial infection, either Pseudomonas or Staph aureus, and may be associated with diabetes mellitus or AIDS and TB. And clinically, there is a single or multiple nodules or abscesses containing granules resembling sulfur granules of actinomycosis that break down, leading to multiple sinuses discharging serous fluid. Healing occurs after many months with atrophic scarring, side, limbs, face, perianal, and breast. Differential diagnosis, of course, from actinomycosis, where there is nodules with granulating lesions that discharging granules. The histopathology is of the granules contain masses of bacteria with surrounding reaction of histiocytes, plasma cells, and lymphocytes with foreign body giant cells. The culture should be done to identify the organism, and of course it is not fungal culture or sabaro culture. We use bacterial culture. Treatment, antibiotic according to culture, Staph or Pseudomonas. And for Pseudomonas, we give fluoxacin or erythromycin and fusidic acid. This is the botryomycosis. The treatment, antibiotic according to culture, either Staph or Pseudomonas. And the botryomycosis is a chronic granulomatous reaction to bacteria, so it is a reaction to bacterial infection, Pseudomonas or Staph aureus, and usually associated with diabetes or AIDS or TB. And there is multiple nodules or abscesses draining, causing sinuses and draining and discharging granules and serous fluid. Healing with atrophic scars in the limb, face, and perianal and breast, and differential diagnosis actinomycetoma. And histopathology, granules may contain bacteria surrounded by histiocytes, plasma cells, and lymphocytes, and foreign body giant cells. The culture should be done to identify the organism, and treatment according to antibiotic according to culture, either Staph or Pseudomonas. This is a picture of the botryomycosis. The actinomycosis is it's a chronic spreading granulomatous disease caused by actinomycetes, anaerobic actinomycetes. Actinomycetes are bacteria producing filamentous branching hyphae. Anaerobic actinomycetes are normal mouth inhabitants, so actinomycosis is acquired endogenously. Mostly actinomycosis israeli and rarely actinomycosis bovis and others. Predisposing factors: poor dental mouth hygiene, dental extraction, and also minor infections of lacrimal apparatus is very common. So it's a chronic spreading granulomatous disease. Etiology: actinomycetes anaerobic, which is a normal mouth inhabitant, and actinomycetes israeli and bovis, and predisposing factor: poor dental hygiene and mouth extraction, and sometimes lacrimal apparatus. The types are cervicofacial 57%, thoracic type 22%, abdominal type 15%, primary cutaneous type, which is uncommon, and pelvic type. The cervicofacial type, usually with poor mouth hygiene and dental extraction, and the thoracic type, usually aspiration of actinomycete from the mouth to a diseased lung, as lung cancer or abscess. The abdominal type originates or the organism reaches the GIT from the mouth, mainly to the appendix and cecum, and the primary is uncommon. The pelvic type associated with intrauterine device. This is the types. The cervicofacial type, it is dull red indurated nodule on the cheek or submaxillary region, leading to multiple sinuses, discharging pus with characteristic sulfur granules, very hard induration, board-like. Extension to orbit, bones of the skulls and brain may occur. So the cervicofacial is dull red indurated nodules on the cheek or submaxillary region with multiple sinuses discharging pus. with characteristic sulfur granules. It's very hard induration, board-like. The thoracic type, extension through thoracic wall to the skin, leading to multiple draining sinuses. There is also cough and hemoptysis, night sweats, and weight loss as active TB. Abdominal type manifested as appendicitis or slow-growing mass. Extension may occur to the abdominal wall, leading to sinus tracts, to the liver, leading to jaundice, to the ovary or kidney. The primary cutaneous type, it's uncommon. There is subcutaneous nodules on exposed skin, leading to sinuses and maybe lymph nodes. The pelvic type, there is no skin affection. This is the types of the actinomycosis: cervicofacial, thoracic type, and primary cutaneous type. As we will see here the pictures, this is the lumpy jaw, the cervicofacial actinomycosis, and also here we can see the thoracic type. You can see here the thoracic type. And there is another picture of the cervical type. Also here we can see another picture of actinomycosis. So this is the actinomycosis clinically, and we said the etiology, predisposing factors, and clinical picture, and the diagnosis. The diagnosis is with the sulfur granules. We take the granules and crush it, and we examine it under microscope. The sulfur granules, yellow 1 to 2 millimeter, adherent to webs of gauze dressings. When crushed and examined microscopically, we see narrow branching forms and elongated hyphae and occasional branching. Culture of actinomycosis israeli, anaerobic incubation for 2 to 4 days at 37 degrees centigrade on enriched media, brain heart effusion, glucose agar. There is white glistening nodular colonies with irregular margins. White glistening nodular colonies with irregular margins. Also the histopathology. We take a biopsy. There is the organisms form granular colonies from which radiates delicate mycelial filaments, some of which bear club-shaped processes, ray fungus. The organism forms granular colonies from which radiates delicate mycelial filaments, some of which bear club-shaped processes, ray fungus. These colonies are surrounded by chronic granulomatous infiltrate. The treatment of actinomycosis, of course, is penicillin. So this is the etiology: actinomycosis Israeli bovis, and with the predisposing factor of poor hygiene, dental extractions, and the types cervicofacial, thoracic type, abdominal type, primary cutaneous type, and pelvic type. The diagnosis: crushing the sulfur granules and examined microscopically, and the culture of actinomycosis Israeli from brain heart infusion, glucose agar, giving the white glistening nodular colonies with irregular margins, and histopathology: the organisms for granular colonies in which radiates the delicate mycelial filaments, and these are surrounded by chronic granulomatous infiltrate. The treatment of actinomycosis is penicillin, 10 to 11 million units per day intravenously for 12 hours daily for 1 month to 45 days, followed by surgical excision of infected tissue. Then intramuscular penicillin, 2 to 5 million units per day intramuscular for 1 year to 18 months. Also tetracycline, erythromycin, chloramphenicol, and recently others are tried. This is the actinomycosis. We want to give a note that the actinomycetes are these are actinomycosis, nocardiosis, actinomycetoma. The nocardiosis and actinomycetoma are aerobic, but the actinomycosis are anaerobic. They are all chronic infections caused by human pathogenic species of filamentous bacteria. The blastomycosis, like pyoderma or Pyoderma vegetans, They are Pyoderma vegetans. We will see they are actually Pyoderma vegetans of Halopio. It is either pemphigus vegetans or blastomycosis like Pyoderma. The blastomycosis like Pyoderma we're talking today is vegetating tissue reaction leading and sometimes from secondary to bacterial infection. So it is a reaction, vegetating tissue reaction secondary to bacterial infection. Clinically, there is one or multiple large verrucous vegetating plaques with scattered pustules and elevated borders resembling blastomycosis, the site in intertriginous areas and face and legs. Some authors observed associations like ulcerative colitis, lymphoma, alcoholism, primary immune deficiency disease. The histopathology, there is pseudocarcinomatous hyperplasia, multiple abscess in the derms, as in hyperplastic epidermis. The histogenesis due to Staph aureus, however, bacteria may be secondary invader. Decreased cellular immunity, decrease in chemotactic activity to neutrophils have been observed. So the blastomycosis like Pyoderma is either Pyoderma vegetans is either blastomycosis like Pyoderma or pemphigus vegetans. It is a reaction, the blastomycosis like Pyoderma, it's a reaction, vegetating reaction secondary to bacterial infection, which may be staph, and it's a multiple or large verrucous vegetating plaques in the intertriginous area, face and leg, resembling blastomycosis. You can see here, this is the blastomycosis actually. And we were talking here about blastomycosis like Pyoderma. So these are the three diseases we're talking about, which are the botryomycosis and the actinomycosis and the blastomycosis like Pyoderma. The differential diagnosis of dermatosis that causes sinus formation like botryomycosis, actinomycetoma and actinomycosis. Now we will talk about Bartonella infection. Bartonella infection, we have here the Bartonella infection, they are gram-negative bacteria as Bartonella Hensley and Bartonella quintana and bacilliformis. The Bartonella infection there are two types we will talk about: cat scratch disease with Bartonella Hensley and bacillary angiomatosis caused by bacilliformis or quintana. The cat scratch disease, the Bartonella Hensley, typical clinical picture includes two components: the primary inoculation papule and the adenopathy. The primary inoculation papule, it occurs in 3 to 10 days after being scratched, and the adenopathy proximal to the inoculation site 2 weeks after inoculation, could be axillary, cervical, submandibular, becomes firm and tender 1 to 5 centimeters. The primary inoculation papule could be vesicular and crusted. In brief, and also the inoculation papule is still present in 60 to 90% when adenopathy develops. In brief, it is a subacute regional granulomatous lymphadenitis transmitted by cats along a large tender swelling of groups of lymph nodes may develop 2 to 3 weeks after a person has been scratched by a cat. It is now believed to be due to bacteria, of course, and the histopathology of papules at the site of the scratch. There is cellular areas of necrosis in the derms surrounded by layers of histiocytic epithelioid cells with innermost layer showing palisading arrangement and few giant cells. The treatment, there is spontaneous resolution, but sometimes the lymph nodes within some months. And also we give antibiotics as macrolides, the ciprofloxacin, tetracycline, and second and third generation cephalosporins. This is the cat scratch disease caused by Bartonella Hensley, as we can see here. Two components of the primary inoculation papule, 3 to 10 days after being scratched, and the adenopathy 2 to 3 weeks after being after inoculation. The second Bartonella infection is the bacillary angiomatosis. The bacillary angiomatosis are multiple vascular papules angiomatous papules in HIV-infected patients caused by Bartonella bacilliformis, and the treatment is also ciprofloxacin, sometimes erythromycin. And this is a picture of the bacillary angiomatosis, multiple grouped dusty red violaceous papules and nodules that resembles a pyogenic granuloma. This is the two diseases of Bartonella infection: aerobic gram-negative bacteria, Bartonella hensleyi, Quintana, and bacilliformis, cat scratch disease, and bacillary angiomatosis. Both are treated with ciprofloxacin. Complete the quiz. Again, the quiz of the dermatosis with sinuses: actinomycosis, botriomycosis, actinomycetoma, cutaneous ulcerative colitis and Crohn's disease, and TB, scrofluoroderma.